Hello, my name is Alex Bogage, and I decided to do my final project on equine therapy or horse therapy. I chose this project for a couple of reasons. First, my boss over the summer was an equine studies major, and she always talked about the benefits of spending time with horses, such as lowering your stress levels and things I'll talk about later. Secondly, throughout the course, I've seen many connections to the topics we've discussed in lecture and equine therapy. Third of all, equine therapy is something I'm curious about and want to challenge myself to learn more about. What is equine therapy? Well, the word equine comes from the Latin roots equus and equinus. But what is equine therapy? Where do the benefits come from? Who benefits from it? Equine therapy is a form of therapy that is often used in lieu of drugs and involves interactions between patients and horses. Patients of equine therapy stand to benefit from a myriad of different things: assertiveness, combating anxiety, confidence, emotional awareness of themselves and others, empathy, accountability, impulse control, stress tolerance, responsibility, flexibility, problem solving skills, self control, self regard, and interpersonal relationships. The actual act of therapy can range from grooming the horses, taking care of its needs, such as feeding it, giving it water, taking care of it, leading it around, and riding the horse, which is something we'll get to later. But where do these benefits actually come from? They come from patient interaction with the horses. Patient interaction with the horse is supervised by a medical professional and a horse professional. Something many people don't think about is that horses are different from humans when it comes to social construct aspects. Humans often overlook the fact that we are judgmental and can make each other feel isolated. For example, if a patient has PTSD from a domestic violence instance, they might find it hard to relate or be comfortable around people, including their therapist. This is a terrible thing. That being said, horses are non-judgmental creatures. Just as dogs have this unconditional love factor, horses are very similar. They help disarm the patient, make them feel more comfortable. It can combat anxiety that manifests from behavior disorders, bipolar disorders, alcohol addiction, narcotics addiction, gambling addiction, depression, and most brain disorders. Once overcoming and conquering these negative thoughts, one can make serious progress in treatment. Anxiety can often be a huge roadblock in recovery. Now, just playing with horses isn't going to fix long-term anxiety, fears, disorders, or any of the aforementioned things equine therapy can help. There needs to be a good combination of animal interaction and therapy from a licensed medical professional. Post-traumatic stress disorder. PTSD is a real issue that affects almost 7% of adult Americans. Treatments for PTSD can range from acupuncture to heavy medication, and these treatments can often have negative side effects due to the heavy medication. Clinicians have been looking for alternatives to medication, and equine therapy seems to fit the bill. In addition, according to Prudence Fisher of Columbia University, most PTSD alternative treatment trials have a 30% dropout rate. The equine therapy one does not. Equine therapy can help children with special needs as well. Equine therapy can help autism, children with learning disabilities, OCD, speech impediments, cerebral palsy, and motor impairments. A form of therapy mentioned in lecture, hippotherapy, is the act of therapeutically riding a horse. This form of therapy can help with a myriad of different things. It can build core strength, it can help improve motor function, it can help engage unresponsive autistics. While researching this topic, I contacted a professor of equine studies at Colorado State University. In a personal communication with her, she shared the story of a 12-year-old girl with Down syndrome who functioned at a 6-year-old's capacity. She had trouble communicating with people and had severe muscle atrophy from prolonged wheelchair use. She continued with horse therapy for 3 months, and she began talking with her sidewalkers during the therapy sessions. The therapy channeled emotion in her. She developed a warm relationship with her horse, Cinco. By the end of Amelia's time with her, she would say hi to her sidewalkers and was able to use a walker when she was only previously able to use a wheelchair. This story warmed my heart. Now, connecting this to our course. In lecture, Professor Ulbari talks about service animals and assistant animals, primarily ADA protected service dogs. Not all dogs can be service dogs. It takes training, certification, and they must like being around people. Otherwise, they would run into some serious issues. The same goes for equine therapy horses. In my interview with Amelia, she said the biggest misconception is that all horses can participate in equine therapy. It takes a specific personality, specialized training, and lots of hours of exposure to have a horse that is suited for therapies. Not just any horse can do this. It's appalling to hear in lecture that ADA in 2010 redefined service animals exclusively as dogs. This means that horses are not covered, meaning they do not enjoy the benefits of being ADA covered. You may be surprised to learn that even though horses aren't ADA approved animals, equine therapy can be covered through certain health plans because it is integrated into physical, occupational, and/or speech therapy. In the article, Equine Therapy as an Alternative to Drugs. In the article, Antidepressants Are Harming Marine Animals, Jake Rawson writes about the negative impacts of discarded antidepressants, such as aggression in crabs and the altering of the brains of fish. Equine therapy can act as an alternative to heavy medication-based depression treatments, thereby helping to eliminate another factor of pollution in our seas. Students requesting service animals on college campuses is on the rise. Usually you'd think of a dog or a cat when you're asked, what does a service animal look like? But why not a horse? Equine therapy trained horses can help combat depression and anxiety. Amelia King spoke a little to the CSU campus and how having their horses on campus helps students get hands-on experience with horses and exposes students who have never seen a horse or experienced horses to that new experience. This made me think. What if there was a spot on campus that hosted a sort of like a Dogs at the Duck Nest event, but with horses? They do the same thing. In fact, horse therapy has had a lot more broad application than just petting dogs. And for fewer students who are exposed to equine therapy, this gives them a chance to spread the profession and spread the awareness. Now, the pros and cons of equine therapy. Let's go to the pros. They're an alternative to heavy medication, which has negative effects on our environment and people can respond to very drastically differently. It helps with the myriad of different issues aforementioned in this presentation. It can be paid for in full or partially by insurance companies. It addresses patients who don't respond well to more mainstream treatments. And children love animals. It's something they feel comfortable with, they open up to, because they're not human, they don't feel threatened. The cons are, it can be very expensive, and there is a risk of injury. Although it is a very low risk, there is a risk of injury. And some people are afraid of horses. My sister, she's very afraid of horses. And not all areas have the luxury of having a space for horses. If you live in a very concentrated city, it would be extremely hard to have a horse there, or an area close by that has a horse. Thank you so much for having a wonderful class. I want to thank the GEs and Professor Ubari. Thank you so much, and I hope you enjoyed my presentation.